Preeti from Dr. Kadu's Orthodontic and Dental Clinic. Today we are going to discuss about the gum recession. What exactly is a gum recession and what are the causes of the gum recession? Gum recession is a situation in which your gums will start lowering on the teeth. It will expose the root of the teeth. You'll find as if the tooth length has increased. In that area of the gum recession, patient may often have a sensitivity with the cold things, hot things, and even with the air. The root which is exposed, it is very much weaker than the normal tooth. So even if you are brushing on top of the root, there can be a chances of the abrasion. Means the enamel loss can occur. In some of the cases, the chances of the cavities on the root will increase. In very severe cases, when patient neglect its gum recession, the cavities can go deeper and it can also involve the nerve of the tooth, which subsequently causes a pain in the tooth and the root canal treatment of the tooth is required. So the gum recession should be taken seriously and it should be treated on the time. So which are the causes of the gum recession? The most common cause for the gum recession is the improper brushing technique. If you are brushing your teeth, you should be gentle enough on your teeth as well as your gums. You should make it sure that you are cleaning your teeth, not scrubbing them. Using a hard toothbrush can also cause a gum recession. If you are not changing your toothbrush oftenly, then the bristles of the toothbrush will flare and it also causes the gum as well as the tooth enamel damage. So which is the proper brushing technique? Which type of the toothbrush you should choose? These all we have already talked in detail in some of our previous videos. The link of these videos are already given in the description box. You can just go and check into that. If you are having high frenum attachment, then it can cause the gum recession as well. What is a high frenum? So what is a frenum? Frenum is a skin which extends from your cheeks or your lips to your gums. Sometimes it is attached directly on your gums in between two teeth. So now whenever the frenum is at a higher level, it is attached directly to the gums. It keep on moving whenever you are talking or whenever you are swallowing. So every time you swallow or talk, the frenum will get stretched. And along with that, your gums also will get stretched, which eventually causes a gum recession. So this is also one of the very common cause of the gum recession, which is mostly neglected. Having an irregular teeth or a crooked teeth also can cause a gum recession. So if you are having a crooked teeth, some of them are inside and some of them are outside. So those teeth which are outside will always get forced more with the brushing, as well as there will be more soft tissue friction on those gums. So there will be more chances of the gum recession. Whenever there is a gum recession, it doesn't cause only damage to your gums. Whenever the gums recede, there is always a bone loss along with it. Bone is a supporting structure of your tooth. So now, in the gum recession, whenever there is a bone loss, you can imagine that the life of your tooth is reducing because the supporting structure, that is the bone, is getting lost. So you should never take the gum recession lightly. Another common causes of the gum recession is your poor oral hygiene habits. If you are having gum infection or if you are having infection in your bone, that is called periodontitis or the pyorrhea, it mostly causes the gum recession. So treating your gums as well as infection in your bone is very crucial. Some of the patients have a deleterious habit of grinding their teeth at night. This habit is called a bruxism. So in such cases, not only the teeth get damaged, but along with that, the gums also will get recede. So we also need to treat this bruxism habit for treating your gum recessions in some of the cases. If your both parents are having receding gums, then you are at a higher risk of having a gum recession. This is more related to your genetics. If you are having a vitamin deficiency like vitamin B deficiency or the vitamin C deficiency, then definitely you will have weak gums, which can more prone to the gum recession. So all these are the causes of the gum recession. So now whenever you are having a gum recession, you must visit your dentist. He will evaluate your case in detail and he will advise you an appropriate treatment for your gum recession. In our next video, we will see what are the treatment plans for the gum recession. So stay tuned with us for our next video. Thank you for watching.